Today's session is part of a calendar of events taking place across Scotland and indeed the whole wide world to mark the 16 days of activism against gender-based violence.
Collective action involving many different sectors and services is taken to tackle violence against women and children and its root causes at a local level. This work is coordinated by multi-agency violence against women partnerships.
I think the measures that we've had to take to stop COVID, that have been necessary because of public health and protect the public from the virus, has made access and help much harder for a lot of women and girls experiencing violence and abuse. And at its heart, we know that this violence continues to be underpinned by women's inequality and the attitudes and structural barriers that perpetuate that inequality. I think we can all appreciate the pandemic has highlighted how fragile our systems actually are and how easy it could be for them to break down. And I think we must ensure that who's learning from this event and learning from all of the work that we do towards better outcomes for women and girls impacted by gender-based violence. And to do this, we all must demonstrate leadership to collaboratively progress this agenda across our various sectors.
Our multi-agency violence against women partnerships are working with local area third sector expert organisations and across local authority universal services, with health services and with the police and many others.
Violence against women is a profound public health issue. It's not an issue that can be addressed on an individual level. Because of the prevalence of it, because of how pervasive it is across our society, because of the different forms of abuse that women and girls are subjected to, it is a very urgent public health priority. And in 2019, the decision to hold the conference during the 16 days of action was based very much on an understanding that we had to unpack them a bit. We had to look at how do we make the most impact on these public health priorities by applying a gender lens to them and understanding the different ways in which these issues manifest for women and for men. What are the circumstances that give rise to the difficulties they experience, and what different interventions would be required in order to make an impact?
The Safe and Together model is a model that looks at the intersection of domestic abuse and child welfare, and it's an example of a shared whole family child-centred approach. At the centre of Safe and Together, there's a set of 3 principles, and I do think that it's worth considering how these apply to other areas of violence against women and girls. So the first principle is to keep the child safe and together with a non-offending parent, and that having a child-centred approach involves really focusing on these 3 kind of key outcomes.
Local government continues this journey of commitment to the realisation of the aims of Equally Safe and to its implementation in local areas, working in partnership with the Scottish Government and the broadest and most diverse range of stakeholders possible. And the most important of these are those who live in our communities, who bring their own lived experience and expertise to this work.
When I was thinking about what permission to lead means and what it means specifically for East Renfrewshire, it came down to 3 things. And the first is that the work is clearly focused on ensuring that the leadership comes from survivors, that the approach is based on women, children and young people with lived experience, changing the services that impact on their lives and making it better for other survivors. And most importantly for them, helping to stop violence against women from happening to other people in the future. That's an absolute priority for the women that we support through the expert group.
So the purpose of the overall programme is to do a deeper dive into the journey that people experiencing domestic abuse take to access specialist domestic abuse services, with an overall view of looking at improving the response to domestic abuse at a wider level. The fundamental outcome of Whole Life Scotland is to amplify the voice of survivors of domestic abuse. That's the heart and start of the entire programme. And we've been doing this through surveys, both the national one that you hear about today, but also at a local level, through running focus groups with people with lived experience. But also about 6 months ago, we created an Authentic Voice panel. So that's 10 women from all over Scotland with different lived experience of domestic abuse and from different backgrounds. And those women have been helping us to shape the outcomes of the project, to share their perspectives and co-create the resources that come out of the work.
The collective leadership flowing from the Violence Against Women Partnership and the ADP expanded our ability to tackle the issues faced by women, the most vulnerable women in our city, and it opened up huge possibilities for collaborative working at a strategic and operational level. The main aim of the Gender Services Group is to lead the strategic and operational planning for gender-sensitive and trauma-informed services in Dundee for women experiencing violence against women, substance use, homelessness, and a range of other complex issues. And it also includes a strong focus on women with lived experience directing our work.
Taking place on Human Rights Day, we're keen that today will provide an opportunity for stakeholders working across a wide range of third sector and public sector agencies and across different policy agendas to discuss what strong leadership looks like in terms of tackling violence against women and girls and gender inequality, and identify actions everyone at this meeting can take within their own area to promote the approach.
And if you look in the screen, this was the artwork that was developed during the conference. You'll see there is reference to collective leadership. What people that took part in the conference were saying to us overwhelmingly was that all of these issues overlap. They all have similar root causes, and that we have to take that whole systems approach and that collective endeavour if we are to make any kind of real difference.
So really thinking about how violence against women and girls outcomes help us in so many different areas of our organisation and making those links clear.
So I've put in two quotes which I think capture very well the two standout themes, in my opinion, from the data set that we have. The first one is about the need for greater knowledge at a societal level about domestic abuse and the services that are available. But also about more collaboration across different types of organisations. And before we launched the findings, we took them to our Authentic Voice panel that I described earlier on. And what they said was they really hoped that these findings would ensure that change makers heard the impact of a lack of joined up approaches to domestic abuse.
Resourcing, the reality is that the current funding landscape is both fragmented and inadequate to meet current need and demand, and it's vital that equitable, adequate and sustainable resource is put in place. Looking forward towards recovery, it's heartening that there is a clear national commitment to strengthen capacity and support in the next phase of Equally Safe, and that this will include identifying the collective leadership and resource required to take this forward.
And I think the one that stands out the most for me is developing a sense of team around violence against women and girls, bringing people together to see where they fit into the picture and the work that we need to do to tackle these issues. Broadening out from the specialist agencies and violence against women focus to include all women who are facing difficulties, barriers and vulnerabilities.